Dr. Hilary joins us now. I'm just reading that again. 1 in 10 couldn't get an appointment at all last year, Hilary. I mean, it's shocking figures amongst all the figures we get regularly, but that is extraordinary.
It is worrying, and the situation's getting worse. I mean, GPs are sometimes seeing 60 patients a day or more, and they're seeing these patients back to back with their medical problems. GPs are doing their best. They're becoming quite exhausted, demoralised. Many are trying to leave the profession early and are taking retirement early. So it's a trend that is currently just going to get worse.
Yeah, I mean, the Department of Health statement says we're committed to improving services. Every patient in England will be able to see a GP 7 days a week. Our pilots to extend GP opening times are proving popular and successful. However, there are some anecdotal reports, aren't there, that actually people aren't making use of these weekend appointments. They're making appointments and then perhaps having quite a nice weekend and not turning up.
Absolutely. So, in the majority of pilot schemes where GPs have provided surgeries on Saturdays and Sundays, they've actually scaled back these appointments because they haven't been taken up. So people want to see their doctors during the week, not at weekends. If the government were to realise their promise of 18 million people seeing a doctor at weekends by March next year, I will personally eat my stethoscope and my emergency medical bag for dessert, because it can't happen. There aren't any more GPs in the pipeline. It takes 10 years to produce a GP, and we've got more GPs leaving than joining the profession. So that is a pipe dream that has been promised that can't possibly happen, in my opinion.
So what's the solution?
Well, there are solutions. I mean, I think one solution is to create medical units run by GPs adjacent to A&E departments. So they work as a kind of triage. People can see them at weekends if they have GP problems, and they're not therefore being passed on to A&E. So you've got a more appropriate dealing of patients by the right person.
Sounds like an interesting solution, that one. There's another report out today, Hilary, saying that 9 out of 10 hospitals, 90% of hospital trusts are expected to be in the red by the end of the year. That's up from 21% last year.
Yeah. What's really worrying about this is that even the highest performing, most efficient hospitals are facing a deficit by the end of this year. So that 9 out of 10 are going into the red. Now, the Department of Health say that they're providing another £8 billion in funding. Doctors, experts are saying that is just enough to maintain existing services and certainly not enough to pay any more staff. Now, if you're not paying any more staff, you're having to recruit more agency staff. And we heard earlier this year how much that is costing the NHS. If we only had more nurses and more doctors, as we should have had years ago, we wouldn't be in the situation we're in now. But it will take time to do that, and I'm afraid patients have to be a little bit patient until that can be done, if there is the government will to do it.